Hello everyone. Welcome to Obesity Prevention in Rural Communities, Stories from the Field. I'm Christine Fry, Program Director at ChangeLab Solutions, and our co-host for this webinar is the Association of State Public Health Nutritionists, or ASPHN. This webinar is part of a larger year-long project sponsored by ASPHN to look at what obesity prevention strategies are working in rural communities. My organization, ChangeLab Solutions, has been working in the obesity prevention movement for many years, and we've observed that obesity prevention resources and conversations often assume that people are working in suburban or urban places, which leaves a whole swath of rural communities out of the conversation. In January of this year, we convened a small meeting of leaders in rural places across the country to talk about what's working in obesity prevention for them and what support they needed to be more effective. Recognizing that we couldn't invite everyone who would want to come and have great things to contribute to that conversation, we are working with ASPHN to provide resources based on the lessons from that meeting that will benefit the larger ASPHN membership and rural leaders from across the country who are working on obesity prevention. This webinar series, and today is one of two webinars that we're doing, is one of those resources that we're providing. So we've invited some of the people that we met through the convening that we hosted, and some other rural leaders who we've encountered in other work to share some really great examples of obesity prevention work that's happening in rural places. We've observed and heard that there is a lack of really good examples from rural communities that are widely known of successful obesity prevention interventions. So we wanted to help fill that gap with today's webinar. We'll have a second webinar next week, so 1 week from today, with two more community examples. So I hope that you'll join us for both. And if you're not able, we will be recording this webinar and next week's webinar, and those will be shared with the ASPHN members as well. We're also developing an infographic that will feature some of the stories that we hear today and next week, as well as more stories from the field that can be used when you are providing technical assistance to rural communities, or if you're in a rural community yourself, to show your colleagues, your leaders, partners about examples of what's possible. So that infographic will be released over the summer. So before we get going with our guest speakers, I'd like to invite Karen Probert from ASPHN, she's the Executive Director, to say a few words about why this topic is of interest to her organization. Karen?
Thank you, Christine. Hello and welcome. Thank you for being here today. Again, my name is Karen Probert, and I'm the Executive Director of the Association of State Public Health Nutritionists, or ASPHN. We're a nonprofit membership organization that provides state and national leadership on food and nutrition policy programs and services. Our membership is composed of about 300 public health nutritionists located throughout the 50 states, the District of Columbia, and 5 U.S. territories. Majority of our members work in state health departments, but we also have members in other state government agencies as well as local level public health nutritionists. We were interested in subcontracting with ChangeLab Solutions for this project because in all of our members' states, they have rural areas, and they were finding that at the state level, they were making decisions and directing policy and needing more information and guidance and examples from rural communities across the U.S. And as Christine mentioned, there are several components to our subcontract, this webinar and the one next week. Also, ChangeLab Solutions will be presenting more information about this project at our annual meeting this June in St. Louis, and then the infographic to be released later that captures the unique challenges and opportunities of obesity prevention work in rural communities. So we're grateful to be a part of this project and thank ChangeLab Solutions for their leadership in this. Thank you, Christine.
Thanks, Karen. So moving forward, this is me, and like I said, I am Program Director at ChangeLab, and lately a lot of the projects that I've been working on have been with rural communities or kind of supporting a group of rural communities and doing training and technical assistance. If you're not familiar with ChangeLab, we are a public health nonprofit that's based in Oakland, California, but we work nationally with states and communities to help create healthier communities for all through better laws and policies. So I encourage you to check out our website. We have a lot of resources on a variety of obesity prevention strategies, and they're all available to download, and we are also available for trainings and technical assistance. So on today's webinar, I'll just have a few housekeeping things about having a good webinar experience. And then I'll just say a few words to sort of frame the obesity prevention conversation that we're about to have with our guest speakers. And then we'll spend the bulk of the time hearing these from different communities around the country about different aspects of obesity prevention work. And I really encourage you to engage with our guest speakers and ask questions. We'll have hopefully a lot of time for that towards the end of the webinar, but please don't be shy in submitting your questions as they come to you. Speaking of which, people tend to be a little shy around the chat box, and that's the primary way that you're going to communicate with us. So we want to make sure that you know how to use it and that you're going to be active participants in the chat box. So look to the left side of your screen. You should see the chat box, and warm it up by telling us your favorite summertime activity. Memorial Day is coming up. The kids will be out of school. It's sort of the gateway to summer. So tell us what you are looking forward to doing this summer. So I already see some people responding. We've got kayaking, hiking, and camping. I personally am going backpacking this weekend, so I am already kicking off the summer with that. We've got people mountain running, tennis, gardening. Yep, got to grow some tomatoes. Walking the dog. Awesome. So it sounds like people are going to have a great summer, and it looks like you guys know how to use the chat box. So please use it liberally throughout the webinar and ask our presenters lots of questions so you can learn about the great work that's happening in their communities. All right. So obesity prevention, as you all know, has multiple components. And it really boils down to making sure people have access to healthy food so that they can eat healthy, and reducing access to or discouraging consumption of unhealthy foods and beverages. And then, of course, helping people get active. Like everybody was saying, they're going to be active this summer with hiking and walking the dog and kayaking and so on. So I was watching a movie a few weeks ago, and it's this classic 80s movie called Say Anything, where John Cusack holds up the boombox. There's that classic shot outside of his girlfriend's house. But I saw that there was an obesity prevention message in that movie. And it was this character that John Cusack plays seems to have an affinity for big gulp sodas. And I noticed immediately when I saw the first shot with him holding a big gulp that it was obviously much smaller in 1989 than what I think of as a big gulp today. So in even just the last 20 years or so, 25 years, the size of the big gulp, and really the portion sizes overall, have increased dramatically. There's been some papers, research papers, that have documented this increase in portion sizes, which ultimately influences what people eat in a sitting and has contributed to this overconsumption of calories and low nutrition foods. So just looking at the soda line here, in the 1950s, a typical soda was a little treat that people had. It was 7 ounces or so. And today, a 42-ounce soda is unfortunately often the norm. Looking at the physical activity environment, so as people are eating more and our environments are encouraging us to eat more, our communities have often become more reliant on cars and designed to promote driving over walking and biking. So the percent of people who walk to work, the percent of kids who walk to school has declined substantially even in the last 40 years or so. And the percentage of Americans who get the recommended amount of physical activity is only 20%. So while we're eating more, we're also not getting enough physical activity. And schools, where kids spend a good chunk of their day for much of the year, have not, unfortunately, been promoting healthy eating and active living. We've seen a lot of low nutrition, high calorie foods in school lunches and snacks and the things that are sold in schools. All the while, opportunities to be physically active have also declined. So these infographics come from a series from the Institute of Medicine. And this last one is a nice summary of what we're all trying to accomplish and really some of the examples that we're going to hear from our speakers today. So the basic gist and what all these strategies have in common is we're looking at ways to change the environment so that they promote physical activity. You don't have to just go to the gym to be physically active, that there are safe and attractive trails in our communities and our schools are promoting it and so on. And then also similarly on the food side, flipping the equation. Right now, we get a lot of messages to eat unhealthy products from our environment through marketing, through what's sold and really promoted in our stores. And so flipping that over 180 degrees so that it's more common to see the healthy foods, so that stores sell fruits and vegetables instead of the high-calorie, low-nutrition foods. So before we get to the speakers, I'm curious what obesity prevention strategies you're working on. I've sort of outlined in broad brushstrokes what's possible, but I want to know what you guys are doing. So we're going to open up a poll and tell us which of these strategies you're working on. And I saw a question, somebody loves the graphics, and these are available from the Institute of Medicine's website. And we can make sure to put a link to those on the page where we share the webinar recording. So I'm just going to give folks a few more seconds here to respond to the poll. It looks like, not surprisingly, since this is a group of public health nutritionists, that increasing access to healthy food and improving nutrition in schools are the biggest areas where people are working. But we also have a substantial number of people who are working on making it easier to walk and bike, increasing physical activity in schools. All right, so let's check out the results. So as you can see, the majority of you guys are working on healthy food interventions, but you're also working on physical activity, decreasing access to sugary drinks. In the chat box, we have people building trails and playgrounds, working on promoting physical activity in communities, improving bicycle infrastructure. Great. So you guys are going to love some of these examples that we're going to hear next. So let's dive in. First up we have Mandy Carringer, who is from an organization called Mountain Wise. It's a group that came out of the Centers for Disease Control's Community Transformation Grant Program, which is working with working with 8 counties in western North Carolina. And Mandy is the intervention lead for Jackson, Swain, and Graham counties. And the organization focuses on increasing opportunities to physical activity, access to local fruits and vegetables, creating tobacco-free places, and getting people access to chronic disease management services. So all the things that we were just talking about. So Mandy, take it away.
All right. Thanks so much for having me and giving me that great introduction. That gives me a little more time to focus on our corner store work. So my name is Mandy Carringer, and I do work with Mountain Wise on the strategies that you just mentioned. And just a little bit additional background, Mountain Wise was actually formed out of the Community Transformation Grant Project. And so we serve the 8 westernmost counties of North Carolina. And when the Community Transformation Grant, or CTG, started, we were supposed to go out into these rural counties in western North Carolina and tell them that we are from the Community Transformation Grant Project and we are here to help. And that wasn't received as well as you might think. And so we took a step back to learn a little bit more about our communities. And some of the things that we learned is that our counties are all Tier 1 designated counties, meaning that they're very economically distressed. They're all rural. Our smallest county only has about 8,500 residents. The largest is a huge city to us because there's 59,000 people there. It's all very mountainous with limited access. The people here have a reputation of being fiercely independent and self-reliant and a history of living off the land. And so there's a lot of culture around farming and gardening and canning and that sort of thing. But still, on average, people only eat about 2 servings of fruits and vegetables per day. And so as we learned all these things, we hired a development group called Allison Development Group and did a lot of surveys and research, and we decided to rebrand ourselves as Mountain Wise. And once we rebranded as Mountain Wise and rebranded all of our materials to actually resonate with our region, things started really developing fast from there. Because we were supposed to go into using strategies that only had evidence for an urban area, and the same things don't work in mountains. When they were asking us to, increase physical activity by sending people to the YMCA, we're like, we don't have a YMCA in our region, and most of our counties don't have gyms where you can go work at, but we have the mountains, we have hiking trails and lakes and that sort of thing. And so once we rebranded as Mountain Wise, we were really able to take off and do a lot of work. And so back to the food access side of things, we started thinking about solutions on what we could do to increase food access and get people to eat more fruits and vegetables. And some of the potential solutions were increasing or enhancing farmers markets, roadside stands, and that sort of thing, increasing the number of corner stores that offer food and beverage options, and incorporating food systems into local planning efforts, because we realized that with the history of farming and gardening and canning and that sort of thing, that people could really get behind those efforts. And so as part of our Mountain Wise branding, we rebranded the corner store effort as Mountain Markets, our Healthy Corner Store initiative. And we started working in mountain markets in the fall of 2013. And the strategy was just to increase the number of corner stores that offer healthier food and beverage options. And since then, we've been able to provide a special emphasis on making that locally sourced food. So our original funder was the Community Transformation Grant Project. So that project ended in the September of 2014. And since then, we were able to receive local funding from our local community foundation, and then now we're operating under the North Carolina ODHDSP grant, or 1422. And so to get this work done, we have had to reach out and develop a lot of partnerships, and that is, to me, the most important thing that you can do is learn who can help you with this sort of project. So our health departments, farmers and growers in the region, cooperative extension, lots of different community organizations, the nutrition departments at nearby universities, Youth Empowered Solutions, the Food Trust, our local Food Policy Council, and a distributor called HT Hackney Company have all been really amazing partners for us. And so this is how Mountain Markets works. We are here to help stock healthy foods and beverages, promote the selling of those fruits and beverages, and in turn, hopefully decrease the promotion of tobacco and alcohol and unhealthy foods in those stores. And so the way that we do Mountain Markets is in 3 phases. The first phase is the assessment phase, where we work with our partners to identify the stores. We look for stores that are in high-need areas, ones that are located in or near a food desert. Out here in rural regions, that's 10 miles from a grocery store. We like to have stores that are already accepting and welcoming SNAP EBT benefits and WIC. If they're not already accepting them, then we work with them to begin accepting those benefits. And in the assessment phase, once we've chosen stores, we assess the stores using a variety of readiness tools that we have. Once we've chosen a store and they're on board, we begin the implementation phase, where we offer supplies and interventions to the store, and then ongoing from there is the evaluation phase, where we do surveys with our customers and our store owners to learn how we can better serve them, what interventions would work, and if they're actually selling the healthy foods that they're stocking now. And we do lots of just verbal check-ins with our store owners as well. And so here is some examples of the materials that we use. We offer the Mountain Markets branding, and we develop branding that we call Wise Choices. And so we have labels that show which choices in store are wise choices for you to choose and promote those. We offer shelving to the stores, price tags, different educational materials such as recipe cards and meal ideas, and the nutritional information for foods and how to prepare the foods aside from just recipes, like what do you do with a bag of dried beans and that sort of thing. We also work with store owners to develop meal kits. So we could have like a spaghetti meal kit special where you have your noodles and your canned tomatoes and some fresh veggies and spices and everything that you need already in one place with a recipe card, so that we can actually turn these healthy meals into a convenient, quick option for dinner. We also work to do optimum placement of items in stores. The other thing that we are able to help our store owners with is marketing of these healthy items. And so we offer signage both inside and outside of the store. We do radio ads, newspaper ads. We do some mail outs to local residents with incentives to come buy fruits and vegetables at their local corner store. The store owner has to offer those incentives. We can't do that part, but we can print out mailers and that sort of thing and work with them to decide on what would be helpful. We've done a couple of TV specials. We recently were featured on UNC TV and their fitness files promoting corner stores throughout North Carolina, and we promote our corner stores at community events. And so here's a little bit of Mountain Markets in action. You can see on the top left the Wise Choice labeling below the grab-and-go tuna. Lots of new shelving for fruits and vegetables. I really love the picture in the middle of all the plants. That's actually part of those are a partnership that one of our corner stores has with the local FFA, so the Future Farmers of America do fundraisers, and the corner store will actually sell plant starts and vegetables for them. We're always promoting local things. We help them find places to source the food, and sourcing can be from local farms, from distributors. Sometimes it's from neighbors with excess in their gardens, which we always love to see. And we do have a new partnership with a distributor in the region, which I'll talk about in just a moment. And then now we're working with an organization called Youth Empowered Solutions to actually get youth in these communities involved in food access and healthy foods in corner stores. Another unexpected thing that we've seen out of this is how much tourism can actually support this project. being we live in a beautiful mountainous region that attracts tourists, tourists are actually shopping at the corner stores and allowing the corner stores to sell more of these healthy items, being able to continuously stock them and sell them at lower prices so that the community can always expect to find them there and be able to afford them. So that's really wonderful to see. We see a lot of positive things with apples and watermelon in the summertime when tourists can come in and get those on their way to the lake or on their way to go on hiking trails and that sort of thing. So this is our newest, most exciting news right now is a partnership with HT Hackney Company. So this is a local distributor in our region who distributes to many of the corner stores, and they have been thinking about it for quite some time about sourcing produce and healthier foods, but they didn't really know where to start. And so we had a couple meetings with them, and it happened so fast they were ready to just start stocking these produce after we talked to them. And so when at the upper small picture you see the little stand, we offer sort of a starter kit. And so we use our grant funding to actually buy the shelving, the labels, and the signage, and then the distributor sources the produce and sells it to the corner store. And so if they're interested in selling produce, they get to start out small with just like apples, oranges, and bananas and see how it goes from there. And I'm really happy to say that the distributor is sourcing the apples locally already, which is really awesome. And now we're offering things like recipe cards on what to do if your bananas get ripe too fast and things like that to help sell that produce. And so a little bit about sustainability for this project. We really believe that incorporating regional food systems into local planning will help sustain local healthy food efforts in our region. Establishing all these relationships and getting momentum going around the project is helpful for that as well. We've built a lot of connections and partnerships, and the partnerships that we're building with the distributors will help keep that produce in corner stores longer than we could do it on our own. And we've also developed a lot of materials and resources that can continue to be used in our corner stores to promote this type of work. There have been a lot of challenges to doing it as well. We've learned how flexible we have to be to get this done, that corner store owners and public health workers do not have the same schedule or the same agenda, and getting on the same page sometimes means that we have to talk to them in 10-second bursts at their register so that we can move out of the way every time a customer comes through because they don't have time to meet with us at any other time. And that's okay. We've learned that one size does not fit all, that we have to be very, very flexible and allow our interventions and strategies to change based on what each individual corner store needs. We're constantly finding new solutions for problems as they arise. Sometimes keeping the store owners interested and engaged in the project is just almost not doable, and that's how our Hackney distributor partnership has really helped us out, that they've been able to just go and stock these items kind of like large companies like Pepsi or Lay's would do, and they manage the healthy stations on their own so that the corner stores don't have to put the time into doing that. We always have to respect the time of the corner store owners and make sure that we're not getting in the way of them being with their customers. And we also know that there are so many people out there to work with if you look for them, that you have to learn to speak other people's language. Like when we're trying to get this into planners, we're able to talk about the economic benefits of it because they weren't interested in the obesity prevention benefits of it. So you don't ever have to go at it alone. All right. Y'all have any questions?
Thanks, Mandy. we're going to move. I don't see any questions coming in quite yet, but I bet they're coming. And we're going to move to Ray next, and then we'll come back around to you with questions right at the end. So
Sounds
thank you.
Great. Thanks for having me.
So next up, so we are now going from healthy small store interventions in western North Carolina to we're going to the western Upper Peninsula area of Michigan. So Ray Sharp is the Community Planning and Preparedness Manager for the Western Upper Peninsula Health Department in Michigan. And if you've ever met someone from Michigan, or maybe you're from Michigan, you know that they illustrate where they're from using their hand, since the state is shaped like a hand. And the Upper Peninsula is the part above the hand, way up right on the border of Canada. So he's led some amazing work on complete streets in communities in the Upper Peninsula. So Ray?
Oh, thank you, Christine. I adapted this this slideshow from one I did last year called 15 Years in 15 Minutes. And this is really going to be 42 years in 7 minutes, so it's going to be about 10 seconds a year, so I'm going to have to go fast. And that's why the slides are here. Hopefully you guys will be able to access them later. The point I want to get out there before I blitz through a few cool examples is this idea that Christine started off with policy systems and environmental change. Just like when Mandy said the nutrition education messages have to go along with food access, it's the same with physical activity. Daily physical activity is great. You can give the kids a pedometer and have them log their steps, or do it at a work site, for 6 weeks. But if there's not a sidewalk or a safe roadway or a place to ride a bicycle, all the pedometers in the world aren't going to make a difference. And that's why we have to work on policy, planning, and infrastructure to rebuild our communities so that our roadways, that in the 20th century the automobiles crowded out places for people to get daily physical activity, we can recreate that way for people to be healthy every day just as a part of their living and working and going to school and things like that. Let's see how this works. Okay, there we are. We're at the Star. We're right up on the north shore of the United States on Lake Superior. We're like any other rural area that we have declining population, our tax base is going down, we have high rates of obesity and chronic disease, and we were designed for the automobile. And like I said, we're trying to redesign our communities to make it safe and attractive and convenient for people to walk and bike every day. We get a lot of snow, so an important thing that we do is clear some of our main routes on the sidewalks with little plows even on the sidewalks so that people will be able to be active year-round. Active transportation is making transportation a part of everyday life. If we were going to make everyone in America, 320 million people, physically active every day to the number of minutes a week that the CDC recommends, we don't have enough treadmills and enough gyms in the United States. It would be mathematically impossible. But we have a lot of outdoor spaces, and if people have infrastructure like sidewalks, and if they have policies like complete streets that ensure that new roadways and renovations on roadways will accommodate the needs of all users, including pedestrian, cyclists, and transit users in planning and allocation of resources, then we can create a healthier community infrastructure. So once you have the policy in place, complete streets, then you need the plans behind it that are tailored to your community, a non-motorized transportation network plan, so that you create a vision and start to bring resources towards projects that will connect where people live and work and go to school and go shopping. And just to remind you, I'll say this like 5 times today, health promotion activities alone, telling people to fill half their plates with fruits and vegetables, telling people to take 10,000 steps a day is not enough. You have to have the environment to support it so that everyone has access. This is what our community looked like. We had declining mining and other industries, and we had a lot of snow to deal with. We were not a very bike-friendly community 40 years ago. You can see when you look at these slides later some of the process steps that we've been taking ongoing to get to the vision of what we want to create. Our vision started in the 1970s with an idea of beautifying, I guess you would say, our town by taking the industrial areas along our waterfront and turning them into public access for parks. But the unintended consequence at the time, because this was year zero of the obesity epidemic, was that we've also created areas by clearing away the industrial debris and ruins on the left and replacing it with safe walking and biking trails. We've created corridors to connect neighborhoods so that people can practice active transportation every day. And this is what it looks like today. It's very inviting for people, and it's very convenient, safe, and practical for people to walk and bike for short trips. You know, 75% of the trips that you take in your automobile are 2 miles or less, and a lot of those could be replaced by more physical activity. The complete streets policies that call for all users' needs being accommodated is a social justice issue, because 30 to 40% of the people in your community do not drive. They're under 16, they're elderly, they have disabilities, they cannot afford to own an automobile, or they choose not to increasingly. They choose to locate even in our rural areas, we have small urban cores where people are choosing to relocate to. And so, you know, it's a fairness issue. We've done a lot of planning, pedestrian planning, bicycle planning, facilities in our downtown area and wayfinding signs, some surveying to determine where our bike routes are, because you don't build a bike route where you think it would be the easiest. You have to connect the destinations, which we call trip generators, the places where people are already needing to go. We've got a broad coalition of stakeholders, including schools, hospitals, businesses, local cities that want to have good connections in between them to build a better network, and even state and federal and private grant sources. We've worked a lot on some innovative policies. One of the policies was the Complete Streets Ordinance that you can see here, that we were one of the first cities in Michigan to pass one, which is unusual for a small rural area to be progressive in terms of politics, but we had this vision of being a healthier community, and that translated into a policy that lays down the groundwork for making sure that our streets are accessible for daily physical activity. You can see some of the projects that are going on, connector trails to connect residential areas with the downtown business areas. You can see something called a road diet on the right, where a 4-lane state highway becomes a 2-lane road with a pedestrian refuge island in the middle, so it's a safer crosswalk. It's traffic calming because the speeds go down when you go to 2 lanes, and people only have to look in one direction at a time to cross the road. Safe routes to school planning. We know that kids and parents recognize that it's fun and healthy to walk and bike to school when it's practical, but they have concerns about safety, and so we have to work on planning and infrastructure to support that. We've done some more sophisticated mapping to extrapolate how many users a year, how many bike trips are on different routes, so that we can refine where we direct resources, which are limited. We developed a non-motorized transportation plan for the city, which guides the development and the spending of resources over the next 20 years. We've greatly increased the ridership to school now. You can see in the spring, once the snow's melted, how many bikes are on the elementary school bike rack. And this is my last slide. So we're at year 42 of my talk now. Remember, policy system environmental change, that's stickier than just the MyPlate coloring book or the pedometer. You have to have the environment that supports the change that you want to see. There are a lot of studies out there now that show that you can build a sidewalk that connects a neighborhood with where shopping and employment are, and don't do any other health promotion. Just do 3-year pre and post surveys of people's health habits and their health status in the community. You don't put up a billboard, you don't pass out any flyers. You come back 3 years after the sidewalk was built and people are healthier. They have lower blood pressure, they're at healthier body weights, and more of them are getting the recommended 150 minutes a day of week of physical activity. So we want to make the healthy choices, whether it's in shopping for food or food in your school or work site or your transportation. We want it to be convenient to make the healthy choice to reduce chronic disease risk. And the same idea that Mandy ended up with, when you talk to community leaders and business leaders, describe community health in broad terms, including economic health, economic vitality, quality of life, creating a community where businesses and young professionals want to locate, and that's how you can sustain a healthy community into the future, and that's how you can sustain support from business and government stakeholders by having that broad, inclusive definition of community health. That's it.
Whew. I'm out of breath. Thank you.
Oh, you're welcome, Christine.
And I love a couple things that I heard from that. I love that you connected back to what Mandy said, and this is something that came out of the meeting that I mentioned in January, was that the obesity prevention frame, even if that's where your funding is coming from or that's what you think of your work as, isn't the frame that often resonates in any community, but particularly in rural communities. And so, like you're saying, it might be economics, it might be quality of life, or the local food economy in Mandy's situation. So great. We'll come back to you in a minute after we hear from our next speaker, which is Kathleen Hine, and she is a community advocate in Crawford County, Wisconsin, Prairie du Chien, Wisconsin. So we're kind of bouncing now down a little bit south from the Upper Peninsula to the southwestern corner of Wisconsin. And among many things, she's a board member of the Driftless Wisconsin Grown, an organization that advocates for local food. And she's also done a lot of great work on school wellness in her community, and that in particular is what she's going to talk about now. So Kathleen?
Hello, thank you for having me. I feel honored to be amongst the other speakers. They're all doing such great work. This is a picture of Crawford County. It's a really hilly area. I know people think of the Midwest as flat, but we live in a beautiful area that wasn't hit by the glaciers, so it's beautiful and hilly. But also very, very poor and sparsely populated, which makes the obesity prevention work, kind of like the others mentioned, more difficult. All of our elementary schools have over 60% free and reduced lunches. But on a positive, they all have very strong farm-to-school programs that we've had for maybe 9 years in the county with school gardens, so that's exciting. The work that I'm going to talk to you guys about today is through our Healthy Roots Coalition. A lot of groups have been doing really great work in the last, for a long time in Crawford County, but we have never really been working together as much as we have, I think, when we started this Healthy Roots Coalition, and it also came out of like a transformation grant and other grants. We thought, why are we all doing this separate work? Why don't we all really work together? So that is what we've done with Healthy Roots, and it's just amazing now that we're working together. It's like a snowball effect. And I know Mandy and both Ray just kept talking about working together, and that is very true. So kind of like Ray said too, we're trying to make the healthy choice the easy choice. I'm going to talk about one specific project, but I put our website on there, and there are we're working on lots of great projects. The project that I'm going to talk about today is our Active School Mini Grants. So basically, 7 school districts were offered just $500, which I know doesn't seem like a lot, for support and resources if they established a team and an action plan to help make their schools more active. Our coalition had, we have members from all the schools and parents from all our schools and coalition. And for a long time, we've been kind of working on trying to form wellness teams at the school. But often, kind of like Mandy said, you can't go in and say, we want you to do this. And sometimes, as I'm a mom, I have kids at the school, and you kind of come across as that health nut. So like, oh, that's that crazy health nut mom. So it was really nice to offer something to the schools that we could help them and really try to mobilize them from within. So why did we choose mini grants at the schools? We felt that working through the schools, we could reach mostly all the children in the county. And actually, we opened it up to a few schools that were just outside the county but on the border. So that's where we have 7 schools in there. And we also know that even small amounts of physical activity improve the school performance. And kind of like Ray was saying, that, I mean, we all know that this is a good obesity prevention thing, but the schools care more about their school performance. So that's kind of how we sold that to the teachers. We also really wanted to establish teams within the school so we could help empower them from within instead of like someone coming in and saying, you should do this, you should do this. We wanted to create a structure in which the schools could learn from each other. Most of our schools are really small, like it's 500 kids from pre-K all the way up through high school. So they sort of feel all alone. So basically what we did was we assigned a volunteer connector from Healthy Roots to each school, and that connector went to the schools and gave just a short presentation on why it's important to have physical activity in the schools and how it decreases behavioral issues and increases test scores. And then the teams designed action plans and submitted things that they wanted purchased for that $500 that would help make their schools healthier. And we really worked on things that were like within the school day, so it wasn't like they had to add a whole, teachers are so busy that they didn't have to add like a whole nother curriculum or a whole nother thing. So we also get quite a bit of snow, and so if it's too cold or I guess not too snowy, kids go out in the snow, but if it's like 20 below zero, the kids usually have to just sit inside during recess. So some of the schools bought indoor recess kits with hula hoops and things like that. Another school, they purchased just balls and frisbees, jump ropes for outside. One of the schools wanted more playground activities for little teeny kids, so like those little teeny plastic basketball hoops. And then we also focused a lot on the brain breaks, so teachers could do that within the classroom. Just take a minute between one class and another to jump up and down and do a funny dance or something like that. And that's just kind of spread like wildfire. As soon as one class started doing it, other classes are doing that. And then the other one that I thought was really kind of cool, thinking outside of the box, is the active hallway. So instead of making your kids walk in straight lines and like, don't touch anyone, don't say anything, the one school put dots and signage in the hallway so the kids have to like hop from, they do different activities in the hallway. So that's a really great way to incorporate physical activity without adding time to a classroom, because the kids have to move from here to there. Like the others talked about, really working together and the sharing has been really extremely helpful. A lot of the classrooms that didn't want to be involved in this are now involved because they saw how successful it was in the other classrooms. And the schools are making changes within each school. For instance, one school, they closed their library during recess, so kids have to go outside and run around. They can't just kind of like hide in the library. Not that reading and stuff is bad, but just we wanted them to get outside and have that physical activity. So the school culture is slowly changing. And also, the schools are working together, and if one school does it, often like kind of like Mandy said, things are like, oh, from big, well, in Milwaukee they're doing this, and that doesn't resonate in small communities when you see what people are doing in Chicago and New York. But if they find out that the school down the road is doing something, then they think, oh, well, we can do that too. And so actually the schools have requested to have regular phone conferences where they can share what they are working on. Another thing that I was asked to talk about was our recess before lunch. And again, I'm trying to stress connection. So our food service directors, and this kind of comes out of our AmeriCorps Farm to School program, they get together once a month for coffee and pie, which is a really wonderful thing. So they just basically chat amongst themselves and share recipes and talk about different policies that are being passed down and how they're dealing with it. So that's really great. So they all saw the benefit of recess before lunch. And then our Healthy Roots group did an activity at one of the schools where we had like a family night where we talked about healthy snacks and for healthy kids. And one of the moms after that talked to the principal about seeing if their school could try that. And one of our schools already had that. So actually the principal said, sure, let's try that. And there were some difficulties with scheduling at first, but between those two schools and actually another school, so we had two schools try it this year, and it was successful. My kids are eating more, and they don't have as many behavioral issues. The other two schools in the county are going to try it for the fall. So just that sharing and working together has been incredibly successful for us. Basically, that's it. So working together so we can do things in our small rural community together, and we can get more done, and then empowering the different leaders in the different communities, since they're all kind of isolated in the hills far away. But if you have empowered leaders from within the community, then they can get stuff done within and then share those experiences with the other communities. That's it.
Great. Thank you, Kathleen. So this is perfect. Our three speakers are perfect because we are, not only did they share great information, but we have time for questions. And so we've had a few questions come in. I want to go back to Mandy first. And a question came in about people are really interested in the distributor, the exciting distributor that you guys have formed a partnership with. And so they're curious if you have advice on kind of how to find a willing distributor who would be willing to serve healthy products in small quantities to small rural stores.
Hi, yes. So the distributor partnership is really new within the last couple of months, and we were really surprised at how quickly it actually happened. But how we started with that is once we found corner stores to work with, one of the questions in our preliminary surveys with the store owner is, how many distributors do you work with? And we asked them who brings them supplies to their store. And so we were able to figure out who some of the distributors are in the region to corner stores through that method. And that gave us a starting point to know who actually in the area would be willing to give those small amounts of items and deliver them on a regular basis to rural areas. And so it turned out that HT Hackney just had a supply warehouse in one of the counties that we worked in. And we just got online and found their contact information. One of my colleagues who works in that particular county, in Haywood County, set up a meeting with them and just went out and talked to them, and it went from there. So it was really just as simple as starting a conversation. And it turned out that, they had been already kind of thinking about stocking produce, fresh produce. They just didn't know how to start. And so we were able to help them start. And I saw your question about what they usually supply. And so right now, as far as fresh produce goes, we're doing a very minimum thing as sort of a pilot project. And so it really is just some small, grab-and-go fruits. It's apples, oranges, and bananas. But they formed a partnership with a regional farm collaborative type place. And we really hope that as long as these small produce items start selling, that we'll be able to extend that to more seasonal produce options as the season progresses. In addition to the produce, just last week we talked to them about other healthy options that they might fill the shelves with. And they already have some options like Cliff Bars or nuts with no salt added and things like that, and of course bottled water and that sort of thing. And they don't have the resources to be able to identify what are the healthy foods. And so they gave us their catalog, and we were going through their catalog slowly and just highlighting the healthy options for them. And we really hope to move forward from there and be able to create some healthy staple items displays through the distributor. And then if y'all want to reach out to me for additional information on that, I'd be happy to share.
Great, thank you. I'm going to pull up your contact slide.
Thank you.
So Ray, we have a question for you. So it's in some, depending on the geography, in some rural places, people might be living in the rural area but then driving to a city for work. So the audience was curious if you have kind of park and ride / walk type policies or programs, or if you have any ideas about serving that kind of commuter population.
Sure. 2 or 3 things that come to mind very quickly. One is informally that's happening, park and ride, and some of it is formally maintained by state highway departments, and some of it's very informal from rural areas. One of the things that's a policy trigger that's moving this changing healthy habits around is that our university is going to higher prices for parking. Parking is hugely expensive between maintenance, building new parking, repairing it, snow removal, and it's highly subsidized in university budgets, and people are paying more of the true cost to drive their cars to the campus, and what that's leading to is more informal arrangements for carpooling. But then to facilitate that, we now have what you commonly see in urban areas. We have places to put your bikes on the front of buses, and we're very hilly, so people can, take their bus up to where they live with their bicycle on the front, or up to the remote shopping areas, and then it's downhill to come back into the city core. So that's another good thing that's come along. And one more idea about complete streets in a very rural or low density road is you're not going to build expensive sidewalks, but most rural areas have no shoulders at all on the roads. And what the highway departments are learning now is that asphalt crumbles from the margin, from the edge inward, and if they will put an extra 4 to 6 foot width of a shoulder beyond the white strip, the fog line, it will double the length of the road project before they have to go and reinvest again, maybe turn a 10-year repaving into a 20-year because it crumbles from the outside in. And that creates an instant bike lane, and you have a rural complete street. So those are some ideas.
That's a great idea. And that reminds me that we've mentioned earlier, this is for the audience, that we are working on infographics of different examples of this sort of work. And one of the examples that we're going to highlight is also related to learning about your state Department of Transportation and how it works, because they can actually, through these different strategies like expanding the shoulder to help them maintain the roads for longer, there's ways that you can make this sort of thing work. And it also ends up saving money for the Department of Transportation. So they're a really good partner to look into. Lastly, I have a question for Kathleen. So a colleague of yours from Wisconsin is in the audience, and they have a question. They're also working in a rural county, and they're having trouble getting the right people to come to the table and come to their coalition meetings. So, and we'll start with you, Kathleen, but if others have thoughts on this as well, feel free to jump in. If you have suggestions for how to gain more partnerships and motivate people to actually get going with your coalition work.
So this is Kathleen. Hi, Sarah. I think that working with like subcommittees, for instance, one of the projects we just rolled out was putting school gardens in the daycares, and so kind of forming subcommittees and then calling out people that might be interested in that instead of just saying, hey, we're having a coalition meeting on health in the community, please come to it, because often those committee meetings can be kind of boring and long, and then people lose interest and stop coming. But if you can find different things, like another group is working on a farm crawl, and so those are totally different people that are really excited about local farmers and farms. And so kind of maybe just smaller groups that are more targeted on a specific thing, we found helps attendance at things.
Great. Ray or Mandy, do you have any thoughts on coalition strategies? It's fine if you don't. Go ahead.
I've got about 10 different coalitions that are working on different things. So we don't have one overarching Healthy Communities coalition like is sort of the standard model, and it really points to that idea of having people on a subcommittee that's in their field of interest. And coming back to that broad definition of community health, it's trying to find that benefit for people participating to create something that they're interested in. So going beyond traditional partners to find people that really have personal motivations to get involved in what the issue is that you're doing.
This is Kathleen again. I'm going to kind of expand because actually, Ray, we kind of owe part of this to you, but our city is allowing our Healthy Rich Coalition to write a health chapter for a comprehensive plan, which is super exciting. But as we go through that chapter, I think like when we talk about bike paths, we'll pull in the people that are interested in biking. So we'll very specifically target specific people to help us work on the different areas of that health chapter. So again, kind of overarching, but finding the people that are interested in special sections.
Yeah, absolutely.
Great. Well, we're at the end of our time together, and I want to thank the presenters. This has been fantastic. I learned a lot, and we already have gotten thank yous from the audience who really enjoyed it as well. So I encourage everyone to, the presenters have very generously offered their contact information, so please, if you have questions, you can reach out to them. Here's my contact information, and like I said, next Thursday we're going to have part 2 of this with 2 more great examples and speakers joining us. And the next webinar will be on Thursday, May 28th. The time is slightly different. It's at noon Pacific time, not 11 Pacific time. And I think Karen will be sending out the registration links so you can get signed up. So thank you again, and have a great rest of your day.